All right, guys, we're going to go ahead and get started. We have a special guest with us today. Dr. Tim Parks is with us, and he is the technical service veterinarian for Merck. He's going to talk a little bit about BOVILIS vaccines and how they can help protect your herd from disease challenges.
Please put any questions that you have in the comments. At the end of this segment, one lucky viewer is going to receive a $100 shopping spree on Merck cattle products. So that's really exciting. So make sure you get your questions in there. And with that, we are going to turn it over to Dr. Parks.
All right. Thank you, guys. Thanks for the opportunity to come out and spend a little bit of time with you today. As we visited before we got started, I really enjoyed the educational aspect of this. So we're going to put quite a few, we're going to talk about quite a bit of stuff around vaccinations and especially around the cow herd, and we'll spend some time there. So if you have questions, be sure and put in. We'll sure try to answer them if we can. And if not, we'll see if we can't make arrangements to get some answers to you. So to start with, though, the thing that I really want to focus on is when we think about vaccination, it's something that comes in a box. It's something that we can purchase and then we can put in the animal, but it's really a tool. And I think it's so important that we remember it's a tool that goes right along with all the other things that we do. The management side of things, the overall herd health programs that we institute for these animals, the nutritional programs, and the things that we do within the environment, just in management. So there's a couple terms that when we think about vaccination, I think is really important that we need to focus on. One of them I'm sure everybody's very familiar with. It's a term called biosecurity. And what that is let's just keep disease processes off our farm. Go to a commercial feed yard and you see the processes that are put in place to try to reduce the chance of a disease process getting into that animal population. If we think about the cow herd, the term that we really use is a term called biocontainment, because so many of the diseases that we focus on in the cow herd live within that cow herd. Diseases like Mannheimia hemolytica, Pasteurella multocida, coronavirus, Clostridium, all these diseases that we regularly vaccinate for are actually bugs that live within that population. So what biocontainment is maintaining a level of protection within that group of animals to where we have a resistance in that population that's up here and the challenge is down here. And if we're at that state, we're going to have nice, healthy cattle. It's when those two things crisscross, that's when we're going to start to see disease processes that are taking place, okay? So one of the things that when we think about biocontainment, in the cow herd, it really starts at the cow level. If these bugs are living within the population, if we can maintain a level of immunity in that group of animals, we're going to really reduce the exposure that the animals are up against. So if we start to think about, let's just take a disease like Clostridium. If we have Clostridium, it's a normal inhabitant of the intestinal tract of cattle. It's shed in the feces. It's out in the environment. If we maintain a level of immunity through vaccination, the amount that's going to be shed is reduced. As we reduce that shed, the chance of disease really drops off on us. That's what biocontainment is, and I think it's so important. So when we think about herd health management and think about herd health programs in the cow-calf, it really does start with that cow, okay? So we had a couple questions that came in already. One of them is does this information equally applicable to goats? Yeah, when it comes to biocontainment, when it comes to biosecurity, it's equal. I mean, it's important in everything. So keep that in mind, okay? Keep those things in mind. What we're trying to do is essentially reduce exposure to animals. We know in the beef sector, when we talk about beef sector, when we wean cattle and move cattle, we're going to start to see disease pressures. So those are some of the things we need to focus on. So the other thing that I think we need to focus on is who are we vaccinating and why are we vaccinating them? So many times we just grab a vaccine and we incorporate a vaccine because it's May and the calves are getting ready to go to grass and we need to make sure we put a vaccine in it. But I think it's important that we understand why are we actually doing that. And as I look, there's people from all over. There's people from all over the country on here, and disease challenges, management practices, all those things are different. So I can't stress enough how important it is. Work with your veterinarian. They'll help you set up these programs. Work with your nutritionist. They'll help you with nutritional programs. They're going to help you to maintain the programs necessary to get us headed in the right direction. Vaccines are going to come into play and help us as a tool again. So it's not the cure-all by any means. But when we think about who are we vaccinating, let's start with the cows. And why are we going to vaccinate the cows? If we think about the cows and the bulls, if we can maintain that level of immunity in them, we're going to acquire what's been thrown around since March of 2020, the term herd immunity that we've all heard. What herd immunity is having enough animals in that group, in that population, that have immunity to a disease process, that we're able to keep the amount of pathogen that they're shedding down. We're able to keep that disease process in control. So if we start with the cows and focus on vaccinating those cows, we're going to develop, it's going to help us with that herd immunity level. When we think about a pre-breeding vaccine, why are we doing that? Ultimate goal in any cow-calf sector is that calf. We've got to have a viable pregnancy, and we've got to maintain that pregnancy. So we're going to focus with that. We're going to focus on, let's get a shot in pre-breeding so we can protect the pregnancy that we're getting ready to create when we turn the bulls in. Okay. So some of those things that others would be BVD. We beyond the scope of today's discussion, but when we talk about PIs and BVD, vaccination early is really going to help us along those lines. So then as we move from the cows and the bulls, now we start to think about that calf sector. So we talk about branding and what we're trying to accomplish with the branding age calf, and that's that calf that's in that newborn up to 4 months of age generally, is we're really trying to get the first stimulation of the immune system. We try to create what we call immunologic memory. That's the key that we need. So as that calf sees subsequent infection or subsequent vaccination, we get that booster response that really gives us the protection that we're after. So we really want to try to start that early. The other thing that these vaccines as a baby calf does is it does give us some protection against the most common disease we worry about, BRD. We get protection as we go through the grazing season and start moving into the pre-weaning and wean season. The pre-weaning vaccinations, this is the booster to what we did in the spring. This is how we get these animals really ready for the first move, the first time that a lot of these animals are going to leave the home of origin, and we're going to start to see some stresses. This gives us an opportunity to really start to get those animals prepared for that first move. And then we think about pregnancy check vaccines. Hopefully everybody's pregnancy checking their cows. We're vaccinating to protect the remainder of that gestational time, but also to start to stimulate antibody production so we can create good quality colostrum. Good quality colostrum going into that calf protects it through the early stages and gets it up to the time when we give those branding ages. So there's reasons why we do each one, and I think it's important that we understand. Again, challenges within every herd, within every management style can be so different that having the relationships with the veterinarian, with your nutritionist, really bring that in to where they can direct you on what products are going to best fit into what you're doing. So let's see if we had any questions that we need to address.
I haven't seen
All
any
right.
yet, no.
All right, so let's go ahead and let's just move a little bit into the vaccines and spend a little bit of time talking about what Merck Animal Health has to offer. We have a line of vaccines called BOVILIS, and hopefully many of you are familiar with products like Vista Once or Nasalgen 3. BOVILIS is a term that we've put in front of all of our cattle vaccines. So if you're used to seeing Vista 5, now it's called BOVILIS Vista 5, and it just brings all of our offering in the cattle space along the biologic lines, and it brings it all together under one umbrella, with the exception of one product, and that's a product called Morexella bovaculi that we co-market. So it still has the same name, just Morexella bovaculi. So with the name change also came some product label changes. So you'll see that Vista Once now says BOVILIS Vista Once, and it may have a different color. It used to be purple, and the colors have changed. But we have some brochures out that are really helpful that can tie everything together. Vision 7, a very common blackleg product, and now called BOVILIS Vision 7, and the labels have changed as well. So I think that's a great to start with. We've brought everything together, so we're able to find the products when we're wanting to find them. BOVILIS is just in front of all of those. Now, if we start at the cow-calf level or at the cow level, I really want to focus a little bit on pre-breeding. And one of the biggest questions that we get at the cow level is the discussion between modified live vaccines and killed vaccines. Both vaccines are effective. Both vaccines definitely have a spot. And again, it depends on the management of your herd. It depends on where your cattle are in a vaccination protocol as to which ones might best fit into what you're doing. So if we think about the two different types of products, they both have advantages, they both have disadvantages. Our Vista line of vaccines, which is our viral line, is a modified live. And modified live is exactly what it sounds like. It's a virus that we grow up, and then we put it into a freeze-dry process, put it into a state of suspended animation. We reconstitute it, it comes back to life, and we administer it to the animal. Either we inject it or with a product like BOVILIS Vista once or BOVILIS Nasalgen 3, we put up the nose. And it's an intranasal. The goal of these modified lives is we reduce it to where we get replication of the vaccine, but we don't cause disease. We don't want to cause respiratory disease with respiratory vaccine, and that's why these products are modified so they can't cause disease. They're going to replicate, they're going to infect cells, they're going to stimulate the immune system in a very, very natural manner. There are some drawbacks to it. If we put it into pregnant cows that haven't seen these vaccines, we can see some abortion issues. So again, very important to make sure that you're putting your protocol together with your veterinarian so you understand where these products fit. Be sure that you're reading labels to make sure what the label indications are for those products. So a killed product is exactly what it sounds like. It's a product that we grow up, we kill it, we clean it up, put it into a bottle with a compound called an adjuvant. And an adjuvant is just nothing more than a compound that helps the immune system stimulate a good immune response against that product. We see it in some viral products. We see it in almost all the bacterial products that you would utilize in a cow herd. The adjuvants vary that we see, and the goal of them is that they will just increase the immunogenicity, or that the ability of that vaccine to stimulate the immune system in that animal. One of the advantages is they are safe in any stage. So some herds where we may not have a bull that gets pulled, or we have a long calving season, and when we process animals, we're at a time frame where every stage of production is there. They're pregnant, they're open, they just got bred. It's very safe. Okay. Some of the disadvantages is we don't see quite as long a duration of immunity, and we just don't get the same stimulation that we'll get with a modified live. So modified live killed is a great conversation to have to make sure that you understand which products are going to fit best into what you're doing. If we focus a little bit on the products that Merck has in that cow sector, a product called BOVILIS Vista 5 VL5 is a product that fits very nicely into the pre-breeding time frame. We like to see these products go into that cow herd basically 30 days before bull turnout. That gives that animal a chance to have a nice immune response before we put the bull in and develop a level of immunity to where we're prepared for calving season. One of the things that we new on the labels, as we've put new labels on, is the protection for BVD type 1B. I mentioned PI BVD a little bit earlier. It's a condition that happens in the first trimester of gestation, so that first 120 days. So a pre-breeding shot with a modified live is very effective in helping prevent that. And type 1B BVD is the most common PI causing subtype of BVD that we see. So very good cross protection at that level as well. And then we think about other diseases that we see in the cow herd. Blackleg. Blackleg is one of the diseases that it seems like we see a really mixed result on cow herds and where they're using it. A lot of times as animals get older, we tend to see not quite as much blackleg going in. We have a product called BOVILIS Vision 7. It's a great product, 2cc product, low reactivity that just does a nice job of stimulating the immune system. It fits well into the cow vaccination protocol as we look at that. So the other thing that we talk a little bit about is deworming, and the use of Safeguard, our fenbendazole product, fits very nicely into cow herds as well. the thing I tell you about deworming is, again, there's so many regions on here. I think it's important that we understand that worm loads in various regions are different. We get to it down in the desert area where stocking densities, we have 1 cow-calf unit per 20 or 30 acres. Worm loads get pretty low. When we get into areas where we're heavily stocking, we can see worm loads that get really high. The best way to find out if you have a worm problem is look for it. Do some fecals, work with your veterinarian, work with Merck Animal Health representatives. They can help you try to find, what are some of the worm loads that are out there. There's some opportunities to find out, and Safeguard fits very nicely in there. One of the things we really focus on is if cattle haven't been dewormed in the fall, when we get ready to send them to spring in the grass, we really ought to make sure they're clean, because we're going to turn them out. And I'll tell you, in our area here in Kansas, we turn them out May 1. By about the 15th of June, they've got a pretty good worm load. So make sure that we're addressing that as well. So let's see if we have a.
Pop this up for you so you can see a little better.
All right. So modified live vaccine given to calves should stay away from mom for how long? If we read the label on the modified live vaccines, any of them, one of the things that it's going to show on there is they're safe for use in those animals if the cow and if the cow's been vaccinated with the modified live within the last 12 months. I think that's a pretty important part of that label that we need to understand. So if we give a modified live to the calf and that cow has been vaccinated with the modified live in the last 12 months, there's no problem at all. It really creates that modified live in that pre-breeding time frame, really creates some opportunities that we'll talk about here in just a second when we get to pre-weaning. But if that cow hasn't been vaccinated with a modified live, then we got to be extremely careful using a modified live in those babies, because there is a chance that you could get some shed. It's a pretty low chance, but it's not on the label, and we got to be careful. So again, great discussions to have with your veterinarian to make sure that you're utilizing these products in the best way that we possibly can. Let's see. Say the labels have changed. What changes are significant for folks who have been using your company's products? The biggest thing that you'll see is that the name has changed and the word BOVILIS has been put in front of it. That's the biggest change that's associated with that. We did change some of the colors on the label, and that has created a little bit of confusion on some of it. But we've got some brochures out. These little brochures look like this. A lot of you'll be able to find them at animal health stores, at vet clinics, at some feed mills. That hopefully you'll be able to find that. You can find it on our website, MerckAnimalHealthUSA.com. You can find them on those sites that will really help kind of guide you through what the new changes are. As far as what the statement on the label is, those haven't changed, with the exception of the 1B claim that we've seen on the Vista as well. So, all right. Anaplasmosis vaccine, how do you feel about it? Well, I honestly, I don't have enough information to give you on that, because it's not a product that we have, and it's not a product that I've used. So there's a conditionally licensed product out there, and I think we'll probably going to LSU, where that product comes out of, might be the best to be able to get you the best information that's available there. So let's move into you explained this to me before, but would you again address why you give Vision 7 to calves, but we don't put the Somnus in cows? Okay. All right. So Vision 7 is given. Somnus is a vaccine on our BOVILIS Vision 7 Somnus line is a vaccine that we see associated. Somnus is associated with respiratory disease. It's also also associated with some abortion issues. We see it used in multiple different areas. Okay, we'll see it mainly in the cow herd level is where we'll see it. It's given very commonly to the calves. A lot of people are putting it into cows as well, just to try to stimulate a level of protection. But Somnus is, as we think about the immunogenicity of pathogens, is really one of the just a tougher bug to get a good immune response to. So a lot of times as we get into those cow herds, people will leave it out of there because we've seen a certain level of immunity and certain level of exposure. And the result, the benefit of the vaccine sometimes is where most of the time that question comes into play. We see it used in both calves and cows. Again, visit with your veterinarian and see what they feel like is necessary in your area. Visit with your animal health people. Let's move over to calf vaccinations, and this is where I think everybody really wants to spend time talking a little bit about, because when we think about calf vaccinations, this is really the first opportunity we have to stimulate the immune system. Creating memory is what we've got to do. We've got to create memory in the immune cells, so when they see a bug, they recognize it and they can act quicker. Okay, the immune system's a fascinating system, because it's a system that has cells that just they float around the body looking for antigens to pick up. So what we can do with vaccines is we can start to prepare these cells so they're ready. When we talk about branding age calves, what we're really talking about is we're talking about that calf really from about newborn up to about 4 months of age is what we're going to focus on a little bit. We always talk about calving season. We're in the midst of calving season right now, and a lot of people have a 90-day calving season or a 65-day calving season. But it really boils down to we have a processing day. So we're going to have one day where we're going to get all these cattle in, so the ages are going to really vary. The reason that's important is because if we've done a good job with our pregnancy or our pre-breeding shots and then preg check shots and created good colostrum, hopefully we've got a calf that's walking around with pretty good maternal antibodies that they got from mom through the colostrum. Maternal antibodies have always been considered that it could affect our vaccines, especially our injectable vaccines. If we put them in and an antibody circulating for IBR and sees IBR and grabs it, we're not going to get the immune stimulation that we want. So if you read labels on a lot of vaccines, it'll say we can use these products in calves 3 months of age or older. That really goes back to the maternal antibody thought. What do we need to do to try to get around maternal antibody and really stimulate the immune system? So one of the newest products that we brought to market was a product called BOVILIS Nasalgen 3 and another one called BOVILIS Nasalgen 3 PMH. They're a combination. 3-PMH is a combination virus, IBR, BRSV-PI3 with Mannheimia, Hemolytica, and Pasteurella multocida. Very common products associated with bovine respiratory disease. It's given in an intranasal route. The reason that the intranasal route has become so popular is when we present antigens through the nasal cavity, that's where about 90% of the bugs that an animal naturally will see is going to originate. It's going to come through mucosal surface. So if we can stimulate an immune response at the mucosal surface, we're really starting to help set up a barrier, but also stimulate the immune system systemically as well. And that immune system in the nasal cavity, it's got little cells that they're just constantly reaching up and seeing what's coming in the nasal cavity. Okay, what's coming in there, and they're grabbing it and they're presenting it to the immune system. And it happens fast. An example I can give you, get pepper up your nose. You get pepper up your nose, you sneeze immediately. That's because the immune system's already kicking in and starting to work. So what we found is if we put these vaccines in the nasal cavity, these cells reach up and grab it, present it to the immune system, and we stimulate the immune system, and we get an active immune response started. So intranasal vaccines have become very popular in younger animals. I mean, we've got products labeled down to 7 days of age. Nasalgen 3 PMH, BOVILIS Nasalgen 3 are labeled down to 7 days of age of calves. So there's opportunities to fit into these various ages of animals that we're dealing with. So intranasal vaccines are becoming very popular as we look at the use of vaccines in these calves. If they're 3 months of age or older, injectables work very well, and BOVILIS Vista Once is a product that fits nicely. One thing that we see with Nasalgen 3 and Nasalgen 3 PMH, it doesn't have a BVD. Need to have the conversation of where are we at in our herd with BVD? Do we need to put it in at this time? If we do, we need to make sure we're putting a product in that fits the label and fits the age of the animals. We have a BOVILIS Vista BVD CFP. Again, it's labeled for calves 3 months of age or older. So there's products that are available. We just need to make sure that we're adhering to the labels that are out there to make sure we're doing things appropriately. Blackleg disease, we've got to get a clostridial in these young calves. It depends on where you're at as to which ones you may use. We have multiple vision products in our BOVILIS Vision line, Vision 7 Somnus that was mentioned earlier, Vision 8 Somnus, CDT, which is a perfringens C and D, as well as tetanus. There's multiples out there. We want to use the product that addresses the diseases in your area. Okay. Panhandle of Nebraska has different diseases than we have in the Flint Hills of Kansas. So we need to make sure that we're addressing the diseases that we're up against. But this vaccine that we put in these calves at an early age, it starts that immunological memory. We need to get it in there so we can start getting these animals ready. Then the other thing's pink eye. Pink eye is a whole different topic. We need to make sure that the vaccines we're using fit the management that we're able to apply to the animals. Some are labeled as a single dose, like Piligard pink eye, BOVILIS Piligard pink eye 1. BOVILIS Vision 2020 Vision 7 is a product that requires a booster. So we need to make sure it fits into our management so we can get the best protection in these animals that we possibly can. And then at the calving, at branding age, the other thing that I can't stress enough, and I think this year is a key topic to have, discussion to have, is around the use of implants. If you're not marketing your animals into a program that basically forbids the use of implants, have a discussion with your nutritionist, with your veterinarian, with your animal health provider around implants. We have the lowest cow herd numbers that we've had in a long time. Demand's still good, and it looks like these calves are being born now in October are going to have a lot of value. We know that products like Ralgro have been around forever. A product like this adds 23 pounds. 23 pounds over not implanted. And if we have time at the end, we can discuss some of the myths around it, but we understand that there's some concerns around the use of it. But what it boils down to is these implants, they change the way that the animal distributes fat and muscle. It increases muscle. It allows us to move these animals past their genetic potential and create just a tremendous safe product. And in the cow-calf sector, the only person that can take advantage of that weight is you. I mean, if you're the one that's utilizing that has that animal in the cow-calf sector, in the suckling phase up to weaning, you're the person that can benefit from these implants. 23 pounds times $2 adds up pretty quick, and it looks like everything indication is that in October calves are going to have value of that, if not more. So great conversation to have, and if we have questions later, we can sure address them around some of the myths that are out there. The last thing that we really focus on a little bit is the pre-weaning vaccinations. Pre-weaning to me is one of the most critical time frames in this calf's life. We've got an animal that we've stimulated the immune system in it as a baby. We've prepared it for these pre-weaning shots. Now we need to stimulate the immune system and get that animal ready for what's going to be the most stressful time that it's seen so far, and that's when we take it up. That's when we wean it, when we take it off mom. So if we can get these animals up 2 to 4 weeks prior to weaning, get a vaccine in them, deworm them, put the virus vaccine, put a blackleg vaccine, we're going to, and then kick them back out on mom. We're going to give them the best opportunity to really have a good immune response and set them up for weaning when we're ready to do that. So at pre-weaning, one of the things we look at, deworm them. If you're in an area where we have a large number of worms and we haven't addressed worm populations throughout the summer, they're going to be wormy. We need to clean the worms out. Worms can have a negative impact on the immune system. Let's get those worms cleaned out so that they have an opportunity to react to the vaccines that we put in. Products like BOVILIS Vista Once fit very nicely at this time frame. If that cow herd is set up to where we can vaccinate that suckling calf. So if those cows have received a modified live, Vista Once fits very nicely. If they haven't, Nasalzin 3 or Nasalzin 3 PMH fits very nicely because they're safe to use in those animals and they're labeled for any class of animals. So there's opportunities for us to stimulate that immune response, really get a good solid immunity against the pathogens that we're worried about with bovine respiratory disease. The other thing, be sure and boost your blackleg at this time. This is a low time of stress in that calf's life, okay? Because we're going to pull it off mom long enough to vaccinate it, and then we're going to kick it back and let it spend a couple more weeks with mom before we wean them. Once we wean them, that's when our stresses start. So if we can get these shots in now, when weaning comes around, we're going to have a great opportunity to see these animals as far as reduction in respiratory disease, and just see increased production in them, and watch these calves gain through the weaning process instead of going backwards. So those are a few of the things that we really want to focus on as we look at that pre-weaning time frame. If you've gone through and you have a good herd health program, I highly recommend look at qualifying these cattle for pre-vac programs. We have a program called PrimeVac. There's a lot of different sale barns that utilize various different preconditioned programs. And we do a lot of work with and analyze data out of a large video auction. And over the last 10 years, what we found is first of all, we've seen a reduction from what we call a VAC 24. We see it became our baseline. It used to be non-vaccinates. VAC 24 means they've at least seen one vaccine. This is a great step forward, because I really like to, I stress to the cow-calf level, I think it's extremely important that once we sell it, I hope we haven't lost interest in the animal. We created that calf. I hope that we have a desire to see it succeed all the way through the production cycle. So let's do everything we can to make sure it has that chance to do it. And these pre-vac programs do it. Pre-vaccination, pre-weaning vaccinations along with weaning is a great way to get these cattle started. If we can wean cattle on the facility that they're raised on, we see a reduction in disease. They get their immune system develops. We get them past the stresses of weaning. We get them in a positive energy balance, and we see these animals gaining, and it really prepares them for the moves when they start to make their way through production cycles and they leave your place. So these pre-vac programs are a great opportunity that we have. The last thing I'll leave you with, and then we'll answer the questions that we have up here, and sure welcome any other questions that you may need or may have. Is I had the opportunity to work on a program. It's called herdhealthmanager.com. It was a program that Dr. Kevin Hill in Utah started when he was with Merck, and it's just a great resource to go to work with your veterinarian, to work with your animal health providers, to put together these programs, these protocols, and it's just a great resource because all of our products are listed there. It'll take you right to the label. The information is just all right there at your fingertips. And it's easy to sign up. It's called herdhealthmanager.com. Sign up. And then the other thing that it does is it has the requirements for PrimeVac. It has a certificate you can print out that has a spot for a veterinarian signature, which is part of the PrimeVac program, that they're veterinary certified when they go to the sale barn. So it's an opportunity for you to put these programs together and just get some cattle that have added value to them. Don't forget about Merck Animal Health, USA.com, our website. A lot of great information out there, a lot of things that are going on, a lot of the promotions that may be going on throughout the year. One promotion right now that's going on is the Vision Sweepstakes. So if you have the desire to win a Greeley Hatworks hat, they're giving away 12 of those custom-made hats. So you can go to poweredbyspur.com, or you can go out to the Merck Animal Health website, so and see the opportunities that are there. So we will, I think we'll address some questions here and see if there's any more that we should go. I work in a vet clinic. How do I get some brochures sent to my clinic? If you will talk to, if you're at a vet clinic, if you'll contact your Merck Animal Health, your cattle rep, they will be able to get some of these brochures to your clinic. Should we vaccinate new stock cows as we bring them in, or should we just vaccinate on the herd schedule? That's a great question, Amanda. When we think about that kind of fits into some of the things that we talk about, especially around the biosecurity side of things. Bringing new stock animals in, bring them in at a time of low risk. I think that's a key that we need to focus on. We have got multiple, when we bring those animals in, if we're in the time of calving, those are the animals that have the chance to bring in their set of bugs to the group of animals that we have. Each group of animal really has kind of its own set of bugs, and it's when we commingle those that we start to see problems. It's recommended that we make sure we get cattle on the same vaccination protocols once they're in the group, but we need to do it at the time that best fits into that, where that animal is in production. So it really depends on where are those animals, where are those animals in the stage of production as to what vaccines we can use, and then how do we transition them into getting them into the routine vaccination protocol that you're in. So it can be you have to make sure your timing fits with labels and make sure that we're addressing the most common concern depending on what stage of animal that is where they came in. Our products are available. Yes, they're available through veterinarians, through Valley Vet. You can get the products available. They have the products like Ralgro or Vista. They're available animal health locations, so available all places. What's the ideal time frame for pre-wean? 2 weeks or more. You know, we talk about the stimulation of the immune system, and the first vaccine that we give is going to take about 14 days to really see antibody levels. Antibodies don't completely mean protection, but it means the immune system is working. Okay, that's what it tells us when we see antibodies. Once we get that first vaccine in, our next exposure is going to happen a little bit quicker. The common time frame is going to be 2 to 4 weeks. Okay, and the reason is we don't want to just stimulate the immune system. We'd like to stimulate the immune system and have those antibodies that are on their way up, because antibodies cycle. They go up and then they drop off with a half-life. So we want to try to get the levels up as high as we can when we're getting into that weaning time, and that's what's going to carry us through that stress of weaning, because we know that stress has caused the release of cortisol, and cortisol causes immunosuppression. So if we can have higher antibody levels, we have an animal that's going to be able to handle stress and handle the challenges that are going to come up against them a lot better. Do you carry a goat-specific line of vaccines or other medications? We have some products that have goat labels, but no, we don't have a goat-specific one. Can you please post this so we can rewatch it? Yep.
This will live on our Facebook page. So yep, you can go and rewatch it anytime.
Oh, the MRA vaccine question. Well, in the cattle space, we have no MRA vaccines, and that's a question that I do not have the expertise on to address. So I don't have that expertise to address. So I'm sorry about that. Can you explain a bit about implants? You bet. Implants they're growth promotants. So Ralgro is a product called zearalenol. Zearalenol it has estrogenic type of effects. And when we think about what happens in the body, we have natural hormones in the body like estrogen, testosterone, growth hormone that stimulate muscle to grow. And what we do with growth implants is we utilize those hormones in order to have an effect on how that muscle develops. So the goal of a growth implant is that we make those animals more efficient in the feed that they eat, and that they lay down more lean muscle. That's the goal of that. So that's one of the things that we really focus on. So what we do, we talk about 23 pounds advantage. If we implant a suckling calf and we compare it to an animal that didn't get, on the average, with the studies that we've done, we see about a 23-pound advantage. They put down about 23 pounds more muscle. They're going to eat a little bit more, but their efficiency gets better as well. It doesn't take as much feed to put on that pound of gain. So that's the goal of that. The other thing to keep in mind with implants is they're additive. So as we think about the different production phases, if we implant them as a baby, we're going to see growth. If we implant them in the stalker phase, we're going to see growth, and it's just additive. It's not, they don't necessarily catch up. So again, they're just a way of increasing the efficiency that we're able to produce beef and do it in a very safe manner. So great conversation to have with your nutritionists, with veterinarians, animal health providers. They get you the information that's out there. We battled pink eye and ringworm last year. We want to stay on top of it. Is there anything else that we can keep on hand? We are still pretty new to this. Well, pink eye, we talk about it as being a management disease and a three-legged stool because what happens with pink eye is generally there's some trauma that occurs to the eye. As long as the cornea is intact, it's going to fight off bugs. But if we get damage there, if we get damage to that cornea, we're going to what ends up happening is bacteria can then start to attach, and when it attaches, that's when we start to have an infection. One thing that we fight is flies. So flies can be a very common problem to help move those bugs from animal to animal. That's where it can become contagious. But it's a trauma that happens that starts it. It could be calves that are grazing. They're sticking their head down through tall grasses that have headed out. That may cause the trauma. It could be that we're feeding in hay in a ring. We get little pieces of hay in there that can cause trauma. So there's things along that line. We do have vaccines that are a tool that can help. But again, we need to make sure we're controlling flies. We need to make sure we're controlling the environment. When it comes to ringworm likes to hang out on old wood. So if you're having a big ringworm problem and you've got a lot of old wood around on an old barn or an old hay manger or something like that, that's a pretty common place. It likes to hang out there. Various different treatments that veterinarian will be able to help you with as far as getting you lined up. Some of them require prescription antibiotics, some require some topicals, but they'll sure be able to help you get those straightened out and what things you can do. Do you have any easy to follow protocol sheets for all ages? No, we don't have any protocol sheets. We have some protocol guidelines that you can, if you look at that herd health manager, it kind of gives you some ideas of common timeframes that people will vaccinate. And then you can just tailor that. You can really tailor that specifically to your herd and to your management style. I can't stress enough that there's so many different management styles, so many different disease pressures within groups of animals, whether it be within the herd or with the animals around it, that it makes it a little bit tougher to just have a set protocol. That's where work with your local people that know what pressures you're up against. They can help you determine what products you really need to be looking at. Let's see. As an ag teacher, do you all have access to information guides or posters for products? Yes, I think we do have that. I'll look over at my helper, and she shook her head yes. So there is some. Again, if you get in touch with your Merck Animal Health representative in your area, they can help you out. Is Safeguard harmful to the dung beetle? No. It's not harmful to the dung beetle. It's fenbendazole is a product. We just celebrated 40 years of fenbendazole. It's a product that's been around for a long time. It doesn't have negative effects on the dung beetle. Is it better to use a sex-specific implant, or is Ralgrow comparable? Is there any concern on implanting calves that may be kept as replacements? Amanda, another great question there. That's one of the questions that we get very commonly. If we utilize Ralgrow is labeled for both steers and heifers. If we utilize Ralgrow as per label, which means that we implant a heifer calf 30 days of age or older, okay, and we don't go out past weaning with it, we have no negative effects. Okay. So again, it's very specific on the label when we can utilize it. What we have seen is with the studies that have been done, we see no effect on conception. So when it comes to the implant discussion, if you're raising seed stock, if you're selling bulls, if you're selling heifers, generally we're going to be selling those animals on a per head basis. And there's not necessarily any benefit whatsoever, and there can be detriment on the bulls to using an implant. So if you're selling bulls, you're selling heifers on a per head basis, probably not the necessity that we see in those animals for an implant. If you're marketing animals on a weight basis, so if you're taking cattle to the sale barn and you market through your local auction barn, if you market through a video auction, and you're what you're paid that day is based on weight, then I think there's a lot of advantage to utilizing implants. Okay. If you're going to save some replacement heifers back and you're not sure which ones you are, I always tell people we have a pretty good idea which ones we're going to save. We're probably not going to save out of the last cycle in our calving season. We want to save heifers that calve early in the calving season, because if mom did that, there's a good chance the calf is too, and that just leads to longevity in the cow herd. So I think we have a pretty good idea which ones that we're going to utilize for our replacements, but we just haven't seen any detrimental effects in the studies that we've done when we look at conception rates after the use of a single implant in a suckling calf. Anything new for bowed knuckles and newborn calves? Oh, a lot of times that's structural, and a lot of times that involves a lot of nursing care that comes into play in the use of splints. So that gets into the nutritional side, and a little bit more on the nutritional side, and I think I'll leave that one to the nutritionist. So
That's all of them.
Is that all of them?
Mm-hmm.
All right. Well, I'd like to thank you guys for the opportunity. It's always great to spend a little bit of time with information and talking about products that Merck has. If there's anything we can do, please don't hesitate to reach out. And if you have questions, don't just the website, Merck Animal Health USA.com is a great source. So thank you guys, and I hope everybody has a great rest of your Wednesday.
All right. Thank you, Dr. Parks. We appreciate it. What an awesome segment. Lots of great questions. Now we have a winner to draw.
All right. Today's winner is Donna Ashcraft.
Donna, you have won a $100 shopping spree towards Merck cattle products. So if you're still on here, go ahead and message us. Melanie's going to help you out.